If you're on this video, you are wondering what is a Medicare Supplement Plan F? And the answer is it's the fullest coverage that you can get. Plan F just stands for full coverage. So as you know, or maybe you don't know, Medicare covers generally 80%. Okay, on Part B, there are some deductibles on Part A, the Part A deductible, the Part A copays on hospital, the skilled nursing copays. We'll go over that in a separate video so you know the copays that are associated with Medicare. But just know that a Plan F, Medicare Supplement, covers everything. It's that full coverage. It's that Cadillac plan. You go to the doctor, the hospital, the skilled nursing, any of that. It's going to cover all the things that Medicare doesn't cover. Now, some people are wondering, hey, what are the networks behind a Plan F? And the answer is there aren't any networks. Okay, with a Medicare Supplement, Medicare is your primary. The supplement is your secondary. So you can go that anywhere that Medicare is accepted, any doctor, any hospital, any clinic. Are there some clinics that don't take Medicare? Sure, you wouldn't be able to go there, but the reality is that about 99% of places, clinics, take Medicare, and all hospitals do. So you're really not going to have to worry about networks. If you want to go to the high-end cancer clinic to get cancer coverage, if you want to go to a specific doctor who treats this specific condition, if they take Medicare, you're going to be able to go there. The other nice thing about a Medicare supplement, specifically a Plan F, is that you need no prior authorizations. So if you have to go in for a surgery, they're not going to ask for prior authorizations. If you want to go see a specialist, they're not going to ask for a referral from the primary care doctor. And so the Plan F, again, it's that Cadillac coverage. It's going to cover everything. You're going to have no copays. When you go to the doctor, hospital, no copays at all. Don't have to worry about prior authorizations. Now, the downside to a Plan F is they are very expensive. And so if you've had a Plan F for a while, you've probably seen some rate increases. And there's a couple ways to offset that rate increase. The one way is to just shop your Plan F. I'm not going to mention carrier names in this video, but let's say you're paying $250, $300 a month, maybe even more. We've seen clients pay up to $500 a month for their Plan F. But let's say you're paying $300 a month for your Plan F. Am I saying to cancel your Plan F and get something else? I am not. I'm saying there might be another carrier, and if you work with a broker like, say, Missouri Medicare Advisors, which is what the company that I own, if you work with a broker, they can actually shop your rates. And the Plan F with one company, because it's a secondary coverage, the Plan F is standardized nationwide. So if a Plan F with one company is $300 and the next company is $200, if you can pass through underwriting, and that's about a series of about 15 health questions, if you can pass through underwriting, you'll be able to save that monthly payment of $100 difference, but you'll have the same exact coverage. Because again, a Plan F with one company, company A, is the same thing as company B. It just comes down to the rate that you're paying. Now, because another thing to mention that I forgot about is that anybody that started their Part A of Medicare after January 1st of 2020 can no longer get a Plan F. So what does that mean for you if you're on a Plan F or thinking about getting a Plan F? Is those rates are going to skyrocket. Because if you think about it, only the people who are on it are getting older and older. And so as people get older, they just generally become more and more unhealthy, which means your rate's going to go up because the cost of care is going up on that plan. So if you're in a Plan F, what I may suggest is that you go with, say, a Plan G, as in Georgia, or a Plan N, as in Nancy. There are some small deductibles, but you still don't have to worry about prior authorizations or referrals. There are just small deductibles. The good side to, say, a Plan G or a Plan N, as in Nancy, and we'll have separate videos on these plans specifically, is they still cover everything. Okay, but they are cheaper. They are cheaper. The only thing they don't cover is some small deductibles on the front end, but a lot of times the math on the back end makes sense, and you don't have to give up the complexities and the quality of care. You can just save some money. So if you have questions about a Plan F, you can always call our office at 417-633-7200. We're always here to help. On the if you need online assistance, you can also go to our website, which is www.MissouriMedicareAdvisors.com.